At 1:01, if you could stand and bow for our invocation. Father, thank you for just the travel graces that you gave us to arrive today. May our time today be spent and conducted in a way to be pleasing to you. In Jesus' name, amen. Shelley, roll call, please.
Yes, sir. Mike Dobbins.
Here.
Dora Petzkowski. Here. Sasha Black Fox Qualls. Here. Danny Callison. Here. Julia Coates. Joe Deere. Kevin Easley.
Here.
Lisa Hall. Here. Johnny Kidwell. Here. Daryl Legg. Here. Cody Poindexter. Joshua Sam. Here. Mike Shambaugh. Here. Melvina Shotpouch. E.O. Smith. Condessa Teehee. Victoria Vesquez. We have a quorum.
Thank you, Shelley. I would entertain a motion to approve the minutes. Okay, all those in favor? Okay, motion passes. On to reports. Instead of George Valier today, we have Commander Murray here to give the Claremore Service Unit report. Welcome, Commander.
I believe you should have George's report in front of you. If you have any questions on that, just let me know. I'll be sure to answer them now if I can, or get you an answer later. Some hot topics around the hospital currently. Last week was Nurses Week. That's always a big week at the hospital. I think we have 120 some nurses. So each day of the week we do kind of a morale activity. We had pancakes for them on Monday, popcorn on Tuesday, cupcakes on Wednesday, I know snow cones on Thursday, and then I was in charge of the grill on Friday, cooking hot dogs and burgers. So always a fun week. They really enjoy it, and it's a lot of fun for us as well. Let's see here, HVAC replacement in the CT. So middle of the week last week, we had the air handler over our CT go down. We were able to divert air from a different air handler and not shut down and divert patients away from a CT. But just kind of a heads up, we have a new air handler arriving this week. We've temporarily pulled air from another air handler. It has to remain 75 degrees or lower to be able to use the CT. So we've been able to do that. It looks like we're going to be able to get the new air handler installed without having to divert any patients. But it's kind of touch and go right now. So that's just kind of a heads up. We expect the new air handler to arrive today and have it installed by the end of the week. So we're just kind of monitoring that situation as the days go by. We also have started an electric car program. We're supposed to be switching over by 2027. We got our first one, the first one in the area of the Indian Health Service on the federal side. So it's a Tesla. I drove it today. That was quite the confusing drive. I've never driven one. If you have, I couldn't start it. I couldn't get it into gear. I got here and I'm not sure I turned it off. So if anybody, it may be running in the parking lot right now. It's quite the experience. So I'm supposed to report back on all the things I got confused so we can provide a manual to our staff. So it's going to be a long list because I was not smart enough to figure it all out. Let's see here. Last, we have the DAISY Award Group. We mentioned that, or George mentioned it right last time I was here, and we've started a new program to promote that and hopefully get more DAISY Awards awarded at the Claremore Indian Hospital. Any questions?
Danny?
Hey, welcome. How many beds and patients do you actually take care of, like overnight stays or 3 or 4 day stays that we do in Claremore now?
Sure. So the hospital is a 36-bed hospital. Now, that doesn't mean they're always full, obviously, but we're accredited for 36 beds. So you could have 36 inpatients at any given time. The census is not anywhere near that. GMS and ICU, I would say between 2 and 10 on any given night. And then OB fluctuates quite a bit. And OB is a bit confusing because when we have a baby, then the child and the mother count as an admission. So you kind of one, maybe hopefully turns into two. I will say that we have 8 OB beds, and for the first time since I've been in there in 8 years, we had to flip over and use an ICU bed for OB this past week. So we had 9 mothers giving birth at the same time. So it was pretty exciting to see that, volume coming back. Absolutely.
Anybody else? Thank you, Commander.
Thank you. I appreciate it.
Okay, from Cherokee Nation Health Services, Dr. Steve Jones.
Good afternoon.
Good afternoon.
Your report should be in your packet. If there's any questions, we'll hopefully entertain those at the end. A couple of things I want to highlight and answer some questions maybe that we have gotten over the last few weeks, just to clarify a few things. So one of them is April 1st, we did start extended hours. That's 7 to 5:30 at all of our clinics. That really has given patients another option, especially if they work. We don't close down through lunch. We are open continuously from 7 to 5:30. It gave employees a chance to work 410s if they can work it out. Of course, everybody has their different availability, so it's not mandatory that anybody works 410s. There are some rules around it by department. The department has to stay at least 50% occupied at any given time, even on their downtimes whenever they're alternating lunches. So there is some limitations to what departments and how many staff they have on who can do 410s, and that's up to the supervisors. But we don't want to take away from patient care. So as a matter of fact, we want to enhance that. And you'll see, today your report is from March, which it's always 2 months behind. But since we started that in April, I saw the numbers that are going to be in 2 months from now in your report. You're going to see a tremendous increase in patient visits. I think some of our departments had the biggest month ever on patient visits this last month. So you'll look forward to seeing that. But I just wanted to clarify, because I think there was not a lot of communication that came out publicly on that. We are trying to get more communication out to our patients. We've been doing things internally in the clinics, but getting things out in the public that those hours are available and those appointments are available. Some of you may or may not be aware, if you track our revenue, that we've had a little downturn in the revenue. One of the clearinghouses that all of the EOBs go through nationally, I think I read an article that they were about 90% of the national handled about 90% of the national EOBs in healthcare got cyber attacked, and that's Change Healthcare. If you watch the news, there was a lot of stuff around the news on it. So we had to find an alternative clearinghouse. We've got that in place now, and everything that was backlogged is starting to be processed. So you'll see a jump, and that jump's going to be attributed to this lag because of the time that we couldn't submit. Fortunately, we are in good place, and we didn't have any problems with maintaining through that downtime. A lot of hospitals did, and a lot of hospitals are still reeling from that. That are a lot of healthcare systems. So that's something that's kind of in our rearview mirror now, and we're moving through it. Cybersecurity continues to be a priority among our training of our employees and watching what's going on, because healthcare systems are becoming more and more of a target. Just this last week, Ascension St. John's got hit, and I understand it's pretty significant, and I don't know how long it'll take them to recover. They're talking like it's going to be quite a while before they can recover from their cyber attack. So just FYI that these things do happen, and we're diligent in monitoring and trying to train our staff. Don't click on that link that you don't know what it is, because those things can cause the whole health system to go down. We're so dependent on technology now that one little mishap can create chaos. So let's see what else. We've just completed, or just this last week, got our survey back from DNV. Every year we get surveyed. Every 3 years we get a very extensive survey where they bring a greater team into our health system, and they go through it with a fine-tooth comb. They look at our policies. They go out and visit our centers. They visit our hospital, they visit all aspects of our healthcare system, and we just got reaccredited this last week. So they had a few concerns. We've addressed those concerns to their satisfaction, and now we're back on to full accreditation. So we'll have another survey next year, but it won't be as extensive as this one. Let's see here. One of the things I want to highlight is start talking about some of the things that our employees are doing. And I just learned about this group back at the first of the year, and so our employees do a lot of community service. They do a lot of volunteer work, and so I thought I would probably start each time I come up here, try to pick a different group and highlight them. This group, because of its Strawberry Festival, I thought it'd be a good time to highlight Stillwell. But they started a group, their employees there, Melinda Parker was the one that started it, and it's called Wilma's Warriors. And they, you guys may be aware of that, I don't know for sure, but they do community events and they do volunteer projects. So this year they started in January. They've done cemetery cleanup for cemeteries that don't necessarily have someone to take care of them. And they've also done, during Earth Week or Earth Day, picking up trash along the highway there along the clinic. So just want to recognize them for what they do. They do this outside in their own time, and it's pretty impressive that they take their time, get together, and do this. I wanted to highlight their vision and mission because they've gone as far as developing a vision and mission, which a lot of groups don't do that, but they did. And their vision was to honor Chief Mankiller's belief in working collectively for the common good. And their mission was to create a sense of community ongoing among our work family and serving others through volunteer projects. They also participated in the Vets Valentine's Day and going out to some of the nursing homes and giving cards and Valentines. So a neat thing that you see that you don't always hear about, but I wanted you guys to hear about because it's something that's going on in the clinics outside of the normal workday. And they should be commended on doing these type of things. We don't require it. They do it completely on their own, and so I wanted to point them out. So with that, let me see if I have anything else here. It is Hospital Week this week, so we'll be celebrating that. There's lots of events going on throughout the week, and hopefully if you see somebody that works in the hospital, tell them you appreciate them. They'll appreciate hearing from you. So with that, I'll turn it back over to Chair, and any questions?
Go ahead, Darrell.
All right, Dr. Jones, I want to brag on the emergency room. We had a lady from Salisbury, Brushy, actually had a stroke, and she said that they saved her life. I mean, they got on it immediately. She said there was probably 10 or 15 surrounded her, and but anyway, I just told her that I'd appreciate it if she wouldn't mind if I shared her story because, you know, usually we always get the complaints, not the praise reports, you know. I guess the second thing was, have we decided on the new hospital whether or not we're going to have like an inpatient rehab for those that maybe got a foot amputated or, you know, have to have a little bit of long-term rehab? It seems like I've gotten 3 serious situations where people were needing to be in physical rehab inpatient, and that's probably a gap in the service that we don't have.
Yeah, I will say that, first of all, our stroke program is by far, we're meeting and exceeding expectations on timelines and how fast we get patients into care and get them treated. So a lot of kudos go out to them. They've gotten recognition nationally for their numbers, and that program continues to evolve. So hats off to them. On the rehab question, it won't be part of our hospital. It's just not feasible with the amount of space that we have to have a footprint for that. We do work with patients to try to get them placed currently, and we have our advocates and our discharge planners that work diligently. I don't know of any cases. You know, if you do have a case that has trouble, please let me know. We're glad to see what we can do, but they have access to a lot of resources and programs that help pay for those type of things. So if they're eligible for services through us, we work diligently to help find a placement for them. finding placement sometimes is the difficult thing within a radius of where they want to go. Sometimes we can find placement, but it may not be as close to home as they want to be, and, that's a problem too, so.
Sasha?
Thank you, Chair. Just a quick question, going over the stats, thank you for providing those. Coming from OB, do you know what our primary C-section rate is now?
I do
Or
not,
currently?
but I can get that for you. Why don't you send that to me in an email, what you exactly want, and then I will try to see if we can get that for you.
Okay, leading to a follow-up question, just doing some research on CMS website. We still provide the 6 weeks postpartum care to those that are not Cherokee Nation citizens but may qualify for Medicaid. Just looking on here, it looks like there's another model that's going to be coming open for application spring of 2024 that would open up postpartum coverage to 12 months. Do you know if that's something that we've looked into?
I know that our teams that keep up with all that will give us a report back when those rules are put in place. Then we'll have to see what eligibility requirements we can do. Even though CMS may say we can do it, IHS may not allow that with our designation of how we get our funding. So right now, we're able to, as you said, provide services to those, to the parent for 6 weeks, so, yeah. But we'll let you know when that comes.
Yeah, I mean,
so.
if so, I mean, the population that we serve, that would be phenomenal to provide care for that
Yeah.
duration. Thank you, Chair.
Okay. Joe?
The dentistry class, I was at the OU graduation with the dental hygienist. You know, there were several that had the Cherokee ribbons. Do you know if we recruited any of those by any chance?
I don't know. I know Dr. Looney goes up and talks to the senior class each year, but I don't know statistically how many of those have come back to work for us. So we can probably find that out for you pretty quickly. I don't know that I think we only have one opening right now in our dental program for a dentist. I know we have a couple of hygiene openings, but I'm not sure where we're at. This is the recruiting time. This is when they're graduating. So if there's someone of interest that's coming to us, I can find that out for you.
Yeah, because with them combining all three schools for the hygienist, there was only 35.
Yeah.
I mean, that was sort of surprising that there was only 35 for that, so it is pretty,
But we do take students,
Yeah.
and we also take students from the Joplin School, which is not part of the OU program, up in our northern clinics, and they rotate through. So we get a pretty good feel of who is a good fit for us and who is not. And we generally focus our services on someone who is a good fit for our environment.
okay, thank you.
Counselor, too, there's a dental hygiene school at TCC, at Rose State, and then OU has a branch in Bartlesville and Weatherford and Ardmore. And they may be opening a branch around Enid. So there's lots of dental hygienists graduating now.
Yeah, the Bartlesville and all those are combined with OU.
Right, they all. Yep.
And I know we get several in our area from TCC. You know, they stay in this area, so we do get a lot of applications from there.
Mike?
Hey, could you get me a list of the drugs that we make available to our citizens through our programs? Could you do that?
The formulary, I thought, was posted on the website. It used to be posted on the website. I'm not sure if it's still there or not.
I didn't
I'll
see it.
check and see.
If not,
Yeah.
would you get me a list?
If we can get that out, yeah, I mean, sure, we can get that out, yeah.
Anybody else?
Is there something in particular that you're looking for on it? All of them? Okay, it's a long list. Okay.
We'll let you go and get that long list together. Any other questions for Dr. Jones? Thank you, Dr. Jones.
All right, thank you, guys.
From Public Health, Ms. Pivek.
Good afternoon. Good to
afternoon.
see all of you today. I have a fairly short report for you today so that you can get on with the rest of your day. You do have the report in front of you. If there are any questions, I'll be happy to address them. I wanted to let you know that farmers market benefits are being issued. They started issuance May 1st through the WIC program to those participants of WIC. And a reminder that Cherokee citizens on WIC get an additional $150 on that. They're being distributed through the EBT cards this year. And I wanted to give you an update. Your report has different numbers because I got the most recent numbers before I got here today. As far as summer EBT, the summer electronic benefit for children, we have served to date 42,512 students on the Cherokee Nation Reservation. And that's 4 times as many as we served last year, all year. And we're still taking applications and still running batches just for the Cherokee Reservation right now and have others to go. So I wanted to let you know and give a shout out to the staff working on that. It's a very hard process and lots of communication with the schools and hopefully get everything out pretty soon. The actual program is open until August. But the benefits distributed at the beginning of the summer, and the way we're distributing them, you get all of your benefits in one card. And if you have multiple children, it's all on that one card. So, letting you know. And the last thing I have today, other than questions, is first wings race. You'll see the wings race continue to expand and get bigger. Our first race this year in March had 1,200 participants, which is a big number for us, and those continue to grow. The virtual option continues to be very popular, so that helps us reach more citizens that participate virtually and then come and either get mailed a T-shirt, come by and get a T-shirt, get added into the statistics. So, any questions today?
Candace?
Yeah, I think that the questions I have may be more appropriate offline, so if I could visit with you just a little bit after
Absolutely.
this?
Yes,
All right, thank you.
absolutely.
Anyone else for Lisa? Thank you, Lisa.
Thanks.
Okay, I see no old business pending nor any new business pending. Any announcements? Just as a reminder, tomorrow at 1 o'clock at the Choda Center will be the native graduation for our first medical school graduates. We'll be recognizing them, but also the native students from Tulsa will be a part of that as well. So it'll be at the Tahlequah campus and the Tulsa campus recognizing the native students. I don't have a total on that. I think there was right about 20, if I'm not mistaken. Any other announcements?
How long will that last?
Depends on who's talking. Probably an hour.
So it's not gonna be 1 to 4,
No,
where you get a shift, it will just be a 1 to 2 o'clock?
probably so, yeah.
Thank you.
Okay, well, I would entertain one more motion. All those approved? Aye. We're adjourned.